Several conditions can lead to a change in urination, what we refer to urinary symptoms. Lower urinary tract symptoms are often abbreviated to LUTS, and they refer to a group of symptoms that can be caused by a number of conditions, but quite commonly they are associated with enlargement of the prostate gland. So that enlargement in turn would result in restricting the outflow from the bladder or the urinary flow. And that can have several other effects, such as causing frequency in urination, whether during the day or nighttime, a sensation of urgency or incomplete emptying of the bladder. But there are other conditions that can have similar symptoms, and there's a long list of them, but perhaps some of the common things are urine infections that can irritate the bladder and result in some of these common symptoms. Other examples include urethral strictures, which is narrowing of the water pipe caused by scarring, bladder conditions themselves, such as bladder stones or overactivity of the bladder, and on occasion, prostate cancer can have similar symptoms or present in a similar way. BPH refers to benign prostate hyperplasia, which basically, in other words, means non-cancerous enlargement of the prostate gland. Now, one of the most common cause for older men to experience urinary symptoms is enlargement of the prostate gland, as most prostate glands will continue growing as men get older. But not every prostate enlargement will result in symptoms. In fact, a few studies have demonstrated that not every man with prostate enlargement will necessarily have bothersome symptoms. But the most common ones, as we discussed earlier, are reduction in the flow of urination, frequency of passing urine during the day and night, a sensation of hesitancy or delay in starting the flow of urination, and as well as a feeling of incomplete bladder emptying and sometimes some urgency with urination. And if a man has any of those symptoms and are bothersome, then it's important to seek medical advice or see a specialist, as in some situations, the enlargement of the prostate could be enough to restrict the flow of urine completely in what we call urinary retention, which could lead to emergency treatment. Usually the assessment will start with a consultation, and that will often include filling out a questionnaire to try and get an idea of the severity of the symptoms. This is usually followed by a physical examination, which includes a physical examination of the prostate, often called as digital rectal exam or DRE. And that's an important part of the assessment because it could exclude other conditions that may affect the prostate gland, including cancer. This is followed usually by a couple of simple tests, one of which is a urine test to exclude infection called a urine analysis or urine dipstick, and then a flow rate test where a man would pass urine into a funnel-shaped urinal that measures the volume and speed of urination, and that gives us an accurate graph and a useful part of the assessment. We often follow the flow rate test by a bedside ultrasound, and we use that to measure the volume of urine left in the bladder after urination. We often refer to that as the residual volume or the post-void residual volume. Blood test can be necessary, occasionally to check the kidney function, and in some men, if there's a suspicion of an abnormality in the prostate, such as prostate cancer, the doctor may request a prostate-specific antigen blood test or PSA blood test. This will, of course, be discussed with the patient beforehand. More invasive investigations are not often required, but they may be necessary, such as an endoscopy or examination of the bladder, what we call a cystoscopy, or pressure flow studies on the bladder, often referred to as urodynamics. This will largely depend on the cause. But if we take prostate enlargement and symptoms as a result of enlargement of the prostate gland as an example, most urologists will try simple measures first. And those can include changing the volume of fluid intake during the day or nighttime, and adjusting the types of fluid to reduce irritants to the bladder, such as caffeine and fizzy drinks, and reducing alcohol intake. Some men may benefit from taking medication to help with the flow of urine. We often use a group of drugs called alpha blockers, and tamsulosin is one example of those. And this can be used in combination with other drugs to reduce the size of the prostate or stop it from getting any bigger. That's not indicated in every patient, but it may be required. Surgery to treat urinary symptoms caused by benign prostate enlargement is often reserved to patients who fail to improve with these simple conservative measures or with medication, and perhaps those men who experience side effects from medication, who no longer wish to take tablets any longer. And nowadays we have a variety of treatment options for men who have symptoms of benign prostate enlargement, and they range from minimally invasive procedures such as implanting devices into the urethra, such as urolift, using steam therapy such as Resume, or more invasive procedures to remove prostate tissue, as an example, transurethral resection of the prostate, or TURP, or laser enucleation of the prostate.